pretty cool. So that's just a broad range of what I do, and I never plan on getting into the addiction medicine stuff, but it has taught me a lot about pharmacology and has really enforced kind of what Bruce was talking about primary care being the middle of the road, and as a naturopath, how you can be the broadest physician that I think we have in the country, because we understand the nature cure, the physiologic aspects. We understand how to support the body's ability to heal, but we can also understand the pharmacology, and we can understand that can just be a tool in our toolbox. And I like having as many tools as I can have, and first asking myself, what's the job I'm trying to accomplish right now? And then ask myself, well, what's the best tool in the toolbox for that? And sometimes it's a medication, or in a primary care practice, I found that medications are really amazing at keeping people safe for a time while you're working on the healing aspect, and then they can get off of a medication later. So this case is, I was really excited to present this case when it first happened, because right away, after it was sort of all resolved and figured out, I was like, this is an NAPCP case, because I feel like this really exemplifies the process of being a primary care doctor and highlights some interesting aspects of being a naturopathic primary care physician. So I called this the DDX, left behind. And if somebody wants to get a piece of paper or something, we could write down DDXs and then sort of cross them off. I think that might be kind of fun to try the process. I was going to have a whiteboard, and that didn't happen, but
okay.
I'm getting over a cold too, so if my voice is, I feel like it's not resonating well.
Sounds pretty good to me.
Okay. This was March 13th of this year when I saw this patient. So this is a 30-year-old male with really no significant past medical history. I mean, he's a really relatively healthy guy. I think folliculitis barbae is his most serious health concern, so just his primary care. So this was a Tuesday. He said, yeah, last Wednesday I started feeling really sore in my low back. He said both sides are hurting, but the left side's worse. And then I said, where's your back hurt? He said, right here. I said, okay. Put his hands right over the CVA area. He said he coughed once the other day and his back hurt really bad right over this area. And he said, my urine, I said, well, like, what else has been going on? He said, my urine's been extremely dark. He said, it's a little bit better if I drink a lot of water, but it doesn't really seem to matter. It's really dark no matter how much water I drink. He said there was no blood that he could tell, or sediment in his urine or in the toilet. And he wasn't having any pain with urination, and there wasn't any change in the flow. It was all normal, except it was really dark. Today he said his pain is kind of minor. He feels like maybe the pain's been improving. It's maybe even described more as a discomfort, but it's noticeable. And he said it feels deep. It doesn't feel like it's, his back muscles, and it's not exacerbated if he's like, using the muscles, bending over and stuff. He's like, it feels like internal more. And it feels better if he's standing up for some reason versus if he's lying down. It's worse. He said the only thing he could think of maybe contributed, he did a road trip that Sunday before the onset. He went to Wenatchee, and his neck was really sore. He said it just was really uncomfortable car seat, and like he thought maybe he hurt his back that way. And he also said that the Monday before that, he was with his girlfriend, and her legs were around him, and they were like messing around. She squeezed him really, really hard on the sides, and he was like, I don't know, maybe she bruised me internally or something. He was kind of, other than that, he was at a loss. So I did a complete review of systems, and everything was normal, except that he had been having fevers and night sweats, pretty copious night sweats for, he said 3 days, but Thursday is more than 3 days before the day I saw him, so it was 3 days. He said 3 days since Thursday, but it was 3 to 5 days, and he said it a lot, sweating a lot, like he's sweating through T-shirts and everything. He's been taking them off. So, and then other than that, he says energy's been steadily decreasing, pretty much. And there was nothing else really to glean from that. With the physical exam, his vitals were normal. He was afebrile. He's a relatively fit guy. He's an African-American male, and he doesn't look sick. Like, he's his normal self. He's just, he's a pleasant guy to be around, and he's sort of joking with me and everything else. He didn't look sick, and so I wasn't really immediately worried in that way. And the rest of his physical exam was normal. There was just nothing. And to important note, there was no CVA tenderness.
How old is he again?
30 years old. Yeah. Okay.
African American, you mean an African that moved to America?
His heritage is Creole, Ethiopian, and a couple of other Eastern African. So his heritage is African
But
and
birthed
in America, as far as I recall. Yeah. So there wasn't a lot there. And so in summary, it's a healthy 30-year-old African-American male, 1 week onset of bilateral back pain over his kidneys, increasing lethargy, fevers, night sweats for the past 5 nights. So what are you guys thinking at this point? There's a pretty large DDX list, but okay, right?
negative CVA. So
Yeah.
yeah, sickle cell.
Sickle cell, okay. So like somebody write down. Yeah. So
Yes. Sickle cell. Sure.
Multiple myeloma.
multiple myeloma.
I'm young.
He's young, but yeah.
What is it? Myoglobulinemia.
Urea, myoglobinuria.
Myoglobulinuria. Yeah. There you go. Makes dark urine.
Yeah, but the pain's interesting to me. So
Would IgA nephropathy, is that?
yeah, right. So I'm thinking, well, there's something going on with his kidneys, right? So I did a dipstick in the office, and there was no white blood cells. Okay, so I wasn't worried about infection after that. There's protein, which I think if you're used to I think that's plus, if that's like what you usually think of it as. And the specific gravity that's elevated, right? And there was a little bit of bilirubin.
I'm sorry, Mike.
Small bit of bilirubin, and the trace ketone, I wasn't necessarily.
So I guess because the dip wouldn't show crystals, you for sure should at least have urolithiasis and rule out.
Yeah,
So
and I don't.
Doesn't fit the feet.
Normally, I would have spun his urine down and looked at it under the microscope, and I don't think I did because I don't remember doing it. It's not in my notes, so it's always interesting when you go back to these things. It's like, oh, why didn't I do that?
A microscope. That's cool.
Yeah, I do have a microscope. Okay, so this was my DDX because at this point I was thinking, well, it's not an infection, but he's got these fevers and night sweats, and so I'm basically focused. I'm kind of thinking the kidneys has got something going on, and also after I chatted with Dr. Mendry about it, she said, oh, you better be thinking about Hodgkin's. I've had a handful of young black males in my practices get Hodgkin's, and it shows up kind of like that. Not necessarily with the kidneys, but just with the fevers and night sweats and stuff. So this is where I was at. And I think the reason that I had put pseudo sickle cell is because when I read about sickle cell, it was the sickle cell crisis is a lot more and it's painful, right? So when I was looking at it, it made sense that if anything, that's what would be going on instead of a full sickle cell. So what test do you want to order?
Well, urinalysis for sure. I mean, obviously.
Micro.
Sed rate, CRP.
Okay. Yeah, so pretty basic ones, and then Ian said A and A, and I don't know if anybody else said that or heard that. So this is what I did. So everything you said, and when I went over this again, I was like, why did I do the microalbumin? That seemed odd to me, but when I thought about it more, I think that what I was thinking was, if he's losing protein, I kind of wanted to get a quantification to then go back and do it again later and see, like, is this getting worse or better? And also, I think I was thinking, he's got protein, but like, what if his microalbumin creatinines, what if there's no microalbumin, then it's